In theory, public administration follows a straightforward path. Parliament passes a statute, a government department delivers the service, accountability is mapped, and if something goes wrong, the citizen has a clear route to a remedy. This is the chain of accountability that a functioning society relies on. But the reality of modern government often looks like this. The chain snaps. A dangerous confusion takes hold where the state treats the administrative output, passing a law or announcing a reform, as if it were the realized outcome for the citizen. A recent dossier submitted to the Public Administration and Constitutional Affairs Committee brings this exact crisis into focus. It asks a highly specific question. Have the massive legislative redesigns of the past decade actually delivered the benefits Parliament promised? When departments are endlessly reorganized without tracking whether the previous changes worked, the administrative machine grinds to a halt. The gears of government lose traction with the actual services they are supposed to provide. The result is a total system disconnect. Citizens are left stranded in a void, navigating the vast empty space between a politician's legislative intent and their own daily survival. To see how this plays out, we can look at the health system. The National Health Service serves as the most visible testing ground for these administrative failures. The Health and Care Act 2022 and the subsequent 2023 transfers consolidated massive power. Critical functions from NHS Digital and Health Education England were entirely absorbed into NHS England. The stated goal was to improve efficiency and operational coherence, yet a paradox emerged. Parliament granted sweeping powers of direction to the Secretary of State and NHS England, but the official parliamentary mechanism for tracking whether accepted patient safety recommendations are actually implemented is completely missing. Now, the government plans to execute another massive wave of structural change. They propose abolishing NHS England, aggressive headcount cuts, and shifting budgets into neighborhood centers, all before producing evidence that the previous 2022 reforms actually worked. Reorganizing major departments without tracking the real-world outcomes creates an illusion of reform. It actively obscures where legal accountability lies, substituting complex new flowcharts for actual patient safety. This pattern repeats across the government. Over in the welfare system, the Department for Work and Pensions reveals the same systemic disease. The massive welfare redesigns of 2012 and 2016 centralized processing into distant service centers. In the name of simplification, the state structurally separated a person's legal entitlement from practical, responsive local delivery. Alongside deep budget cuts, the government altered how it monitors child vulnerability. By replacing specific income-related poverty targets with a broader life chances framework, the system actively reduced its own visibility of early material hardship in large families. This chart tracks a specific demographic shift. Between 2011 and 2022, hospital admissions for self-harm among 15 to 19-year-olds rose by 37%. This data sits alongside the cohort of children who grew up under the 2012 and 2016 welfare redesigns. While a single causal chain is difficult to isolate, the coexistence of administrative instability and rising adolescent distress suggests a pattern of cohort risk. When the state alters how it monitors vulnerability, it risks losing sight of the damage its own policy changes may be doing to future national resilience. Both the NHS and DWP share a fatal symptom, the liability loop. In fragmented systems, responsibility endlessly circulates. Primary care points to specialists, specialists point to remit boundaries, and welfare centers point to rigid rules. No single entity holds accountability. The citizen experiences this breakdown brutally. At the exact moment of physical or cognitive collapse, the patient or the claimant is forced to become the sole project manager of their own survival, navigating the blind spots between government silos. A system designed without clear accountability doesn't just fail, it places the entire burden of its own complexity onto the citizen at their most vulnerable moment. Restoring the chain of accountability requires a mechanism to test these reforms before they are enacted. The House of Lords warned that structural changes often dilute ministerial responsibility. A constitutional impact assessment addresses this by mapping every statutory duty before a single function is transferred. Under this framework, the government must explicitly document who holds the statutory responsibility, who holds the risk, and exactly how a citizen secures a remedy when harm occurs between institutional boundaries. This acts as a necessary hard stop, forcing the state to prove that democratic accountability and legal responsibility will survive any structural transition intact. The United Kingdom cannot responsibly continue reorganizing its critical health and welfare systems without first proving that past reforms delivered their promised benefits. Traceable accountability has to remain completely intelligible. The line connecting a government minister to the delivery of local urgent care must be unbroken. The ultimate validity of public administration is measured strictly by the reliable protection it affords its citizens, not by the sheer volume of legislation it produces.